Hi, everyone. Thank you for your patience and welcome to this month's Teach Educational Round. Today presenting, we'll have Lauren Rutka, and we'll also have Laurie Zawertailo joining us later and presenting on nicotine pouches, your questions answered. So to start off today, we'll begin with KMH's land acknowledgement. KMH is situated on lands that have been occupied by First Nations for millennia. Lands rich in civilizations with knowledge of medicine, architecture, technology, and extensive trade routes throughout the Americas. In 1860, the site of KMH appeared in the Colonial Records Office of the British Crown as the council grounds of the Mississaugas of the New Credit, as they were known at the time. Today, Toronto is covered by the Toronto Purchase Treaty Number 13 of 1805 with the Mississaugas of the Credit. Toronto is now home to a vast diversity of First Nations, Inuit, and Métis who enrich this city. KMH is committed to reconciliation. We will honor the land through programs and places that reflect and respect its heritage. We will embrace the healing traditions of the ancestors and weave them into our caring practices. We will create new relationships and partnerships with First Nations, Inuit, and Métis, and share the land and protect it for future generations. So now, and as people have already been doing, which is great, we invite you to identify the land you're joining from today. And you're also welcome to add on to that and share something that you're currently doing to learn or improve your commitment to reconciliation. For anyone that just joined, I'll just put the link in the chat again that you can use to find out which land you're joining us from today. And in the meantime, I'll share my own personal land acknowledgement. My name is Rachel. I am a second-generation Canadian located on the lands of the Mississaugas of the Credit, which is covered by Toronto Purchase Treaty 13. And I continue to listen and learn about the stories and cultures of various Indigenous communities and ensure that their voices are heard. And this is just a reminder for today. To receive a letter of completion for this Teach Educational Rounds, we ask that you first make sure you have registered for this webinar and completed the pre-learning assessment with that. Also to have signed into this webinar using your first name and your last name so we can track you, and to complete the evaluation and post-learning assessment, both of which will. And so a bit more about our presenters today. Dr. Laurie Zawertailo obtained her PhD in pharmacology at the University of Toronto in 2002. Dr. Zawertailo's research interests are in the areas of behavioral and neurobiological aspects of tobacco dependence and treatment, especially in individuals with comorbid depression or alcohol use disorders, which are subpopulations who have an especially high prevalence of tobacco dependence. And here with us today, we also have Lauren Rutka. Lauren has a Master of Science in Occupational Therapy from Queen's University. She is currently working as a therapist at KMH's Nicotine Dependence Clinic under Intrepid Lab. And her areas of interest of clinical practice focus on both nicotine cessation and harm reduction strategies for a diverse client population using principles of motivational interviewing, cognitive behavioral therapy, mindfulness, and acceptance and commitment therapy. So welcome, Lauren.
Thank you.
And I'll also give everyone a moment to read through both presenters' disclosures. No worries. And all Teach Educational Rounds presenters or eligible presenters are offered an honorarium for their presentation time. However, acceptance of this honorarium does not affect presentation content. And this is to note that the content of Teach Educational Rounds are centered on evidence-based guidelines from the following sources. And also to note that these materials, as well as any verbal presentation or any discussion, represent only general principles, and they don't remove the need for clinical assessments or treatment plans by healthcare professionals. And with that, I'll pass it along to you, Lauren, to get started. Thank you.
Okay, great. Thank you so much, Rachel. Just making sure everyone can hear me okay. We are going to be presenting, thank you, Tom. We're going to be presenting today on nicotine pouches. First off, thank you all so much for sending in your questions ahead of time. Laurie and I did our best to try to address these questions within our presentation, and then there will be some time at the end for any other questions that we maybe didn't cover in our time. So I'll get us started. So we came up with some learning objectives. So we hope that by the end of this webinar, you'll be able to identify the prevalence and current perception of nicotine pouches, both within the clinical setting, but also sort of the broader public, describe the regulatory health guidelines around nicotine pouches, identify any potential for abuse and dependence of these products, and then to lastly describe the effectiveness of nicotine pouches for smoking cessation. So we'll first start off by describing what are nicotine pouches. So they are a smokeless, spit-free nicotine delivery product. They are tobacco-free, so they contain either a synthetic or a purified form of nicotine, contained in a small microfiber pouch that has a powder made up of nicotine, different flavorings, and then fillers, sweeteners, and stabilizers. And in terms of how they're used, they are placed between the gum and upper lip. The powder within the pouch dissolves, releasing nicotine through the oral lining, which then enters the bloodstream. And it is recommended that pouches are discarded after use with a maximum recommended amount of 15 per day. In terms of some current side effects that we are aware of, so we know that they are harmful if swallowed, and side effects of improper use do include lightheadedness, nausea, and hiccups. There are contraindications that have been outlined by Health Canada for these products. So they are not suitable for individuals under the age of 18, not to be used if allergic to nicotine or other products, other ingredients contained in the product. Not suitable for those with a history of seizure, for individuals who are pregnant or breastfeeding, and then not intended for occasional smokers, non-smokers, or non-nicotine users. There is also a recommendation to consult a doctor if there are any of the following medical health conditions, such as heart, thyroid, or circulation issues. So we'll get into the regulatory health guidelines. So in terms of what we know at this time, Health Canada has authorized for sale 4 milligram nicotine pouches, and they are specifically authorized as a form of short-acting nicotine replacement therapy. And again, specifically only recommended for use as either a harm reduction or a quit aid for individuals who are current nicotine or tobacco users. And Health Canada did put out a guideline as well to recommend 4 milligrams of nicotine pouches for individuals who do smoke upwards of 25 or more cigarettes per day. We're going to talk a little bit about kind of how these products are being targeted to youth. And in 2024, some restrictions were introduced to limit youth access. So that included banning from convenience stores and making them only available for sale in pharmacies. And as well, fruity flavors have been prohibited. So only mint and menthol are allowed at this time. And just a couple of headlines, as nicotine pouches are kind of becoming more known in the public. So just put a couple of those little headlines. Okay, so now in terms of perceptions, so there were a few studies that were looked at. So I looked at a couple cross-sectional surveys that did look at how nicotine pouches are perceived in the public. And what did come up a lot was that the public does view these products as less harmful and less addictive than cigarettes and vaping. And this perception is especially strong among adolescents and young adults with previous tobacco use, who also perceive them as more socially acceptable than cigarettes. Users of these products have also cited things like convenience, the discreet use of the product, the fact that there's no odor, and a variety of flavors as enhancing the appeal. Additional motives or potential motives for use also include considering these products as a form of cessation support. There's a general curiosity around these nicotine pouches, as they are a relatively new product, and social influence from friends. And just to note, there were some limitations in these studies in that they were small samples, most not nationally representative of Canada, with limited follow-up. Did look at another study. So this was an observational study conducted on Reddit, which is an internet forum and a very rich source for understanding real-world user experiences. And this study analyzed perceptions of oral nicotine pouches through Reddit posts from February 2019 to February 2021. And there were topics grouped into different categories as listed here, so such as sharing product information and user experience, and using these nicotine pouches as a quick aid for other nicotine and tobacco. So what we did see from this study is that the posts did increase over time, which reflected an increased interest in nicotine pouches, as well as kind of reflected a growing market, market growth in the products. Sorry, I'm seeing some notes in the chat. It's a little hard to hear. Okay, my apologies. I'll try to speak a little louder. A lot of what came up in these posts were interests in things like flavors, using these products as a quitting potential, and viewing perceived safety around these products as well. A lot of the users did cite recreational use with these pouches and discussed different high dose strengths, anywhere from 6 milligram to 16 milligrams. And the post did show that 54% showed a positive attitude towards nicotine pouches, about 30% were neutral, and 15% were negative. Some reported symptoms do suggest a need for more health research, especially on oral and pulmonary effects. And so looking through, again, some of these studies, as well as just doing a search of online market retailers selling unauthorized nicotine pouches, again, through the internet in Canada, a lot of these sort of theme words did come up. So these products being perceived or sort of described, advertised as safer, more discreet and convenient, clean, modern, you know, marketed as a lifestyle, and tobacco free. So in terms of how this is, you know, being considered in the clinical setting, I actually have a question back sort of to the audience. You can either kind of put a yes or maybe like a thumbs up to let me know if nicotine pouches are making their way into your clinics. Seeing mostly yeses. Okay, so thumbs up. Okay, so lots of people are seeing them. All right. Right, so as Rachel had said, I do work as a therapist in CAMH's nicotine dependence clinic. So we do work with the adult population to help support clients in their goals of either nicotine cessation or harm reduction. And at this time, we actually haven't seen them too much show up in our clinical practice. We are tending to see individuals who are reporting, transitioning from more commercial cigarette or e-cigarette products to more traditional forms of nicotine replacement therapy, like the patch, gum, and lozenge. It might be that, we are servicing more of an older population that maybe just have not yet been exposed to these products. I did confer with colleagues in the Youth Fast program, which is a relatively new program also under Intrepid Lab, targeting youth ages 13 to 21, to see if it's shown up there. And again, it hasn't quite made its way into their clinic either. However, in speaking specifically to one of my colleagues, she did a presentation recently at Toronto District School Board, where the sentiment among members of TDSB was that the nicotine pouches are making their way into the schools and gaining popularity. So essentially, pouches are in, vapes are out. It seems that there's been lots of sort of crackdowns on trying to eliminate e-cigarettes out of schools, more punitive measures put in place. And the fact that these nicotine pouches are quite discreet, easy to conceal, can be done indoors, there's no odor produced. And when you look at the product themselves, they're contained in a container that looks like a pack of gum or mint. So it does seem anecdotally that there is, a increasing popularity, again, of these products among the youth population. I would say even for myself, I've heard of increased popularity, through informal channels of the community. So it'll be interesting to see sort of in the next coming months how that does sort of translate to the clinical setting, and of course validating a possible trend amongst certain populations that we do see. But for those of you who are currently seeing this already, we do have some harm reduction tips. So things to be mindful of for clients or patients that are coming into the clinic reporting the use of nicotine pouches or maybe expressing interest. So these have been outlined by Health Canada as well as Intrepid Lab's lower risk nicotine use guidelines. So again, if the client is coming and using nicotine pouches, the recommendation is to ensure that they are authorized by Health Canada. So there should be an 8-digit NPN number on the label. You can also check if the product has been authorized for sale by searching Health Canada's licensed natural health product database. And then the pouch is 4 milligrams and sold in Canadian pharmacies only. There is a recommendation that if your client requires a higher nicotine concentration, to suggest the use of 4 milligram nicotine pouch in combination with a nicotine patch. And then, of course, keeping these products out of reach of children and teens at all times. And a few take-home considerations. So we know at this point, nicotine pouches are regulated in Canada for NRT use only, but we do see that recreational interest is strong. Youth are most at risk due to marketing and lifestyle factors, and more user education is needed on the safety and health impacts, especially for youth. So I'm going to turn it over. I see Laurie has joined, and I'm hoping I did see some questions in the chat come up, which I'm hoping we can address at the end, but also hopefully Laurie can also touch on some of these great questions that have been coming up. So thank you very much.
Great, thanks. And yes, I finally was able to join, thanks to lots of people helping out. Yeah, apologies, computer glitches. Okay, so can I advance my own slides, Rachel?
Yes, you should be able to. Are the arrows there for you?
Okay, yeah.
Perfect.
Okay, so a lot of you submitted questions in advance. Thanks very much. So these are your questions answered, and I'm going to try and go quickly so that we have time for the questions that are also showing up in the chat. Okay, so the first question was, how quickly is nicotine from pouches absorbed or enters the bloodstream compared to other products? So This was a study done in 2022, and this is what's known as a pharmacokinetic curve. So basically, you give a product, a drug, every hour for the next 12 hours. And I know it's difficult to see, but the solid squares are the nicotine pouch, 4 milligrams. The solid circle is nicotine gum, 4 milligrams. And the open triangle is nicotine lozenge, 4 milligrams. So you can see that they're all comparable and that the pouch, 4 milligram pouch, is actually comparable to the nicotine lozenge. So they really are bioequivalent, but the nicotine lozenge and pouch get a slightly higher peak concentration compared to the gum, actually almost twice as much. But the time to peak is pretty similar. Okay. These are just the actual numbers from that same study. So you can look at what the actual pharmacokinetic parameters are. Okay, what about compared to cigarettes? So this was a different study and different pouches. So nicotine pouch number 2 was called the Zone X, 5.8 milligrams. It's not available in Canada. Nicotine pouch 3 was Zone X, 10.1 milligrams. So these are higher dose nicotine pouches. And the comparator here is a cigarette. So the study participants' own brand of cigarettes that they were asked to smoke. So you can see that the cigarette in the red, both the peak concentration and the time to peak concentration much higher than pouches, time to peak much sooner because it is inhaled, distributed through the lung alveoli and into the bloodstream. And then there's this dose-dependent peak concentration of nicotine, depending on whether it's a lower dose patch in the green or the higher dose patch in the kind of mauve. But the peak concentration is much, much lower than that of a cigarette, even with these higher dose patches. So, and again, these are just the actual numbers from those graphs. And then there was another study done again in 2022 that compared a bunch of different nicotine pouches to cigarettes. And these again are just the pharmacokinetic parameters. These are the milligrams contained in the pouch. So there's Zyn 10 milligrams. That's the popular pouch from the US. And you can see that again, the peak concentration is more similar to cigarettes, 11.9 versus 13.9 nanograms per mil. The time to peak, however, is much, much longer. So 65 minutes for the Zyn pouch, 7 minutes for the cigarette. And, you know, from an abuse potential perspective, the time to peak is a really important parameter. So the faster the drug effect and the max plasma concentration, which is equivalent to brain concentration, you know, the more likely the drug is to be abused. So from an abuse potential perspective, it appears, at least pharmacokinetically, that pouches will have less abuse potential than cigarettes. Okay, so what about subjective effects? So this is that urge to smoke. So again, this study was done in smokers, and you can see right after a cigarette, the urge to smoke goes down. Same with the pouches, but slightly, you know, it's a bit attenuated, probably because the concentration of nicotine isn't as high. But then the urge to smoke kind of reaches, becomes, there's more of an urge to smoke sooner with nicotine pouches compared to having a cigarette. So, you know, you have a cigarette and it takes, you know, an hour to 90 minutes before you feel like you want another cigarette. Whereas with pouches, it seems to be a little pushed to the left. So you want a cigarette sooner. Again, these are in non-treatment seeking individuals. So Product liking, very similar across the board. You know, cigarettes right after a cigarette are liked the most, but pouches have, you know, there's a lot of liking. So smokers like the effect that the pouch gives them, and there is relief from withdrawal as well, as evidenced by the urge to smoke question. So the other question was, what are the effectiveness as a cessation aid? And then another question was the ethics of recommending this product for cessation when it's manufactured by Big Tobacco. And I will let everyone decide on their own ethics around that. We can open it up for conversation, for discussion, if there's time. But it seems, at least in one small study, that the 4 milligram nicotine pouch was somewhat effective as a replacement for smoking. 16% of participants had a 50% decrease in cigarettes per day, and about 8% actually quit. So not super effective, but there is some effectiveness. As I mentioned, the abuse liability seems to be much lower than for cigarettes. So use among non-smokers, or recreational use, or intermittent use, that was another question. You know, if the choice is between a cigarette and a pouch, then of course a pouch would be much safer. If the choice is between a pouch and doing nothing, then obviously doing nothing is much safer. There was another question around the long-term effects on health, oral health, and cancer risk. This is not known. You know, these pouches haven't been around for long enough. But there was evidence that it should be lower than with oral tobacco products like chew, snuff, or snus. And there really is no known cancer-causing components to a nicotine pouch. There is effects on other oral health potentially, but again, not nearly as bad as oral tobacco products. Okay, so what about helping people quit pouches? How do you help people quit using pouches? So as we see from the first graph that I showed, you know, the nicotine lozenge is bioequivalent to the nicotine pouch. So, you know, if your patient is interested in using NRT to help them come off nicotine pouches, lozenge would probably be an effective replacement. Patch plus lozenge, perhaps. But, you know, nicotine pouches are considered NRT by Health Canada. That's how they're approved. So, you know, it's replacing one type of NRT with another. So, you know, if a patient is interested in that, I think that's perfectly fine. They can also try just weaning, or using, you know, other non-nicotine lozenges or mints to help them with the behavioral aspects of not using a nicotine pouch. Okay. Okay, so prevalence of nicotine pouch use in youth. So as Lauren said, you know, there are lots of anecdotal evidence that it's becoming quite prevalent. Survey evidence is a little less available. So, you know, amongst all adult smokers in Canada in 2021, there seemed to be about a 3% prevalence. But those, of course, that's not the population that we're interested in here. In the US and the UK, there seems to be between 1% and 2% current use among youth in 2024. I couldn't find any Canadian data, but if someone has some Canadian data, I'm happy to discuss it. How are youth accessing nicotine pouches? That was another question, and it's mostly online. So again, from non-regulated, non-Health Canada approved sources of nicotine pouches, or from friends. And I think Lauren talked a little bit about resources for youth educators, parents. So we have our program Youth Fast that has a number of resources, and we also have our low-risk nicotine use guidelines that have been updated now to include recommendations regarding nicotine pouches and low-risk use of nicotine pouches. So Those were all the questions that were submitted beforehand. I think I went fast enough to leave lots of time for additional questions, and I kept seeing things coming up in the chat. So maybe Rachel, you can moderate the chat and we can start discussing some things.
Thank you, Laurie. And yeah, perfect. We have a lot of time for some questions. Someone was asking, is there a risk difference between oral NRT gum lozenges versus pouches?
Yeah, so it's a great question. There doesn't seem to be to date, but you know, it's a difficult thing to study because you know there isn't that many people that use these things long term or habitually. But you know, you don't hear many reports of things like mouth blisters. I saw someone put in the chat that mouth blisters was a common complaint of nicotine pouch use. And you know, short-acting NRTs are used over the short term, like the vast majority of people. You hear, again, anecdotes of the occasional person who, you know, has a nicotine gum or lozenge kind of habit that they continue long after quitting smoking. But it is a rarity, whereas, you know, long-term use of nicotine pouches, I think, will become more and more of a reality. So, you know, from a safety profile, oral NRT gum and lozenge, I think, is safer. But just from a, you know, components of what's in pouches versus gum, it's or lozenge, it's pretty much identical, except for like the cellulose, what makes the pouch kind of pouchy, kind of pillowy.
Thank you. Someone had also asked, in terms of chemical and physical harms, is it better than vaping?
So you know, again, the empirical evidence is not, has not been established yet, but just, you know, I would say intuitively it would be, just because, you know, there are flavors, and there's food safe flavors just like they are in vaping, but you're not inhaling these things. And so, you know, when they're deemed food safe, it's for ingestion, not for inhalation. And so you know, if you're ingesting these flavorants, etc., via nicotine pouches, it's most likely a lot safer than inhaling via an e-cigarette. Plus, nicotine pouches don't have the other components of an e-cig that are potentially harmful, like the particulate matter and fine metals, etc., that people expose themselves to using some e-cigarettes.
Thanks, Laurie. There was another question, seeing if we could confirm whether nicotine pouches use nicotine salts or free-base nicotine.
Yeah, so it depends on the pouch. And there's also pouches that use synthetic nicotine, not tobacco-derived nicotine. And so there's differences in the racemic ratios. So there's the R nicotine versus the S nicotine, and whether that affects either the subjective effects of the nicotine or the absorption. So it all depends on the pouch, and there's no information actually on the pouch about whether yeah, what type of nicotine is being is in that actual pouch.
Thank you. I noticed another one. If you could comment on the risks of starting to take nicotine in non-smokers.
Yeah, so you know, nicotine is an addictive substance, but the harms from use of nicotine are predominantly from combustible cigarette smoke, right? So the nicotine doesn't cause the harms, even though it is the reason, well, the primary reason why people smoke or vape. So the purer the form of nicotine, the less risk there is, besides the risk for developing a dependence or addiction. So, you know, and as I also pointed out in the pharmacokinetics, you know, the route of administration also has a huge impact on whether any drug will be abused. So smoking is the worst from an abuse potential point of view, and oral ingestion is the least. So, buccal absorption, somewhere in between. The jury is still out on whether nicotine itself has effects on things like brain development, even though you'll hear that a lot, that it does. There's no actual evidence in humans that that's the case. Beyond, brain changes that we know occur as in the addiction process. So, like I said, I think if you have a young person who, is experimenting or feels like they need to use nicotine, go with the safest forms and the shortest term use possible, and delay that use for as long as possible.
And again, some of the articles that I reviewed prior to this talk was that there is also a risk of it potentially being a gateway into other nicotine and tobacco products in future. So again, it was a preliminary comment, but just something to keep in mind.
Thank you both. And is there any research on the comparison of chewing tobacco and the pouches?
So I saw one study where they compared not chewing tobacco, but the snus, which again is like a pouch that sits in between your gum and your lip, but it's tobacco. It's not just nicotine. And there's definitely more exposure to obviously carcinogens and other tobacco-related nitrosamines, et cetera, from those products than from pouches. So again, if the choice is between chew or snuff or snus or pouches, then pouches are by far the safer option.
Thank you. And there was another question on how long someone would keep the pouch in for.
Yeah, so generally I think it's around 30 minutes until like the flavor is kind of lost. And I think the recommended maximum number of pouches per day is 15. So that's, I guess 1 per waking hour.
And there was someone that wanted to clarify about the carcinogenic content and whether there have been TNSAs identified in some non-tobacco nicotine pouches, and whether this is not a concern because of the levels present.
Yeah, so there have been, especially in the non-regulated products, some TSNAs and NALs, et cetera, detected in the pouches, but again, yeah, in far, far less levels than you would find in a cigarette or other tobacco, oral tobacco products. Is it a concern? It's hard to say. It all depends on the level of exposure of those contaminated pouches in the individual.
And then, sorry, Laurie, could you clarify for people what a TNSA is?
So a TSNA is a tobacco-specific nitrosamine, which is a byproduct of tobacco that is potentially carcinogenic.
Thank you. And then on the topic of nicotine salts and comparison between traditional NRT like gum and lozenges and pouches, do lozenges and gum ever contain nicotine salts?
Not to my knowledge. The current like Nicorette lozenges and gum are just free-base nicotine, as far as I know.
Thank you for clarifying that. And then another person asked if people are purchasing non-Health Canada regulated products over the internet, would the same regulations be applied to the production of these from other countries when looking at food grade flavorings and pure nicotine?
Yeah, I would not. I would say that if you're buying them over the internet, there's probably they're not adhering to any sort of good manufacturing process or anything like that. There's, yeah, so you really don't know what you're getting or what how they're being manufactured or quality controlled for.
Thanks, Laurie. And then Emily was also asking if there is a scenario where pouches would be recommended more than other forms of short-acting NRT, in your opinion.
Again, not a clinician, but I can't imagine, you know, unless cost is maybe an issue. I think they are a bit cheaper than nicotine gums or lozenge. And I guess, yeah, if someone has a really strong personal preference, you know, lots of people can't use the gum. I've heard that many complaints about the nicotine lozenge. But yeah, I can't think of a case where you would recommend a pouch over a lozenge, but maybe.
And are there any established guidelines for using nicotine pouches as a cessation aid?
Yeah, so it's similar to other short-acting NRTs. So just using it as needed when there's an urge or craving to smoke, and then yeah, like I said, the maximum up to a maximum of 15 pouches per day.
Perfect. Thanks for clarifying that. And what would be a schedule that you would recommend to wean them off, or is there a set schedule for that?
Yeah, good question. I think it would all depend on the person and how motivated they are and how dependent they are. But I would say maybe replacing every second pouch with a non-nicotine lozenge or even a nicotine lozenge if they're trying to wean off using other NRT. I think it really does depend on the person and how long they want to spend weaning themselves off.
Thanks. And Brad wanted to know if there is any talk of marketing these products over the counter with other nicotine products rather than behind the counter at the pharmacy.
Yeah, so the Health Canada regulation to put them behind the counter is less than a year old, I think. I don't think there's any move at all to bring them back in front of the counter. Yeah, I think it's probably there to stay for the time being until TikTok stops posting videos of kids stuffing pouches into their mouths.
And someone had also asked if all nicotine products have carcinogens in them.
No. So like I said, nicotine is not a carcinogen. The other components of tobacco, and especially tobacco once it's combusted, have many carcinogens in them. So, nicotine replacement therapy, quality controlled will not have any carcinogens or in any appreciable amount that would actually cause cancer.
Thank you. And then someone had asked if 4 milligrams is considered a high dose. Is there a lower nicotine pouch dose that is available?
Yeah, so there used to be a 2 milligram dose, but when I went on the company website, am I allowed to say Zonic? It looks like it's only the 4 milligram that's available right now. So it is in Canada. It's the only dose available that's Health Canada approved and regulated. In the US, I don't even think they have a 4 milligram. I think it starts at 8 and goes up. So I guess it is considered a lower dose.
And then I think adding on to that, I think, are you able to generalize from nicotine content how many cigarette smoke would be the equivalent to using a 4 milligram pouch?
Yeah, so if you look at the, if you remember the pharmacokinetic curves, so, not only does cigarettes cause a faster and higher increase in the nicotine plasma concentration, the area under the curve, so the actual amount of nicotine that stays in the bloodstream over time, is much higher. So, a 4 milligram nicotine pouch, it's probably equivalent to maybe half a cigarette. So the amount in a pouch versus the amount in a cigarette is not equivalent to what is actually absorbed into the bloodstream. So you need to consider that it's not a one-to-one. A cigarette contains 2 and a pouch contains 4, and so a pouch is 2 cigarettes. It's not. That's not how it works.
Thanks for clarifying that. And then there were just a couple more that I found. Do pouches have any known hazardous effects on mouth cavities?
Yeah, so there's again anecdotal reports of mouth blisters and canker sores and effects on kind of gum health. But beyond that, it's a little too early to say that, yeah, these are widespread problems or a definite consequence of using pouches. It may just be in people who are vulnerable to those sorts of things. Hard to tell.
Thanks, Laurie. And then the last question I saw was if the cost is comparable to gum and lozenges, the cost for nicotine pouches.
Yeah, so I think they're cheaper, although I'm not entirely, I just know that short-acting NRT can be really, really expensive. And I think pouches are quite a bit less expensive. So I think a tin is $8 or something, but a thing of lozenges, which will probably last you longer, is more like 40.
Okay, thank you. So it looks like that's the end of the questions, but as you can see on the screen, Laurie and Lauren's emails are both there if anyone has any questions that come up. And I'm just looking at the chat. Thank you both for a very engaging and informative webinar. And as you can see, other people felt the same as well. I'm just gonna wrap up with some housekeeping items, but if anyone has to leave at this point, that's okay. Thank you, Laurie, and thank you, Lauren.
I saw one final question pop up, but maybe not.
You did? We have time to take it if let me. Oh, is it how we can calculate the number of nicotine pouches required for an adult having a 25-pack a year?
Yeah. So again, it's impossible to really say. I think if that person is motivated to smoke and it's motivated to quit, I'm sorry, and really only uses the pouches for intense breakthrough cravings, then they probably would get away with less than 10 per day. But it all depends on the person and how desperate they are to replace the nicotine that they're no longer getting from cigarettes. If it's 25 pack year history, is that what you said? I wouldn't just do pouches. I think you probably need a patch there too.
Thanks, Laurie. And then there was just one more that I think we can get to quickly. Speaking of the types of nicotine found in products, do you know what type is found in Sonic?
I don't want to misspeak. I think it's a nicotine. I don't want to misspeak. I will check and I'll get Rachel to
Yeah, for
put
sure.
the answer in the
Feel free to
group.
share.
Yeah, I'm not entirely 100% sure. Sorry.
No, thank you. It's okay. Thanks for answering, both of you, for taking the time to answer all these questions. I'll just again get to these housekeeping slides because I feel like we've wrapped up for our time today.
Great.
Put in
And Rachel, if you could also send out the lower nicotine use guidelines with the.
For sure. I will include
on that
that as well in our post-webinar email, so everyone will have access to that. Thanks for reminding me. Lauren, sorry, did you have something?
Oh, I just said I just put the Health Canada product website in the chat, just that describes the Sonic product. So if there's more information there as well.
Perfect. Thanks, Lauren. So then just a reminder that if you want to receive a letter of completion for this webinar today, the post-learning assessment and evaluation will be sent out, and you'll have a week to complete that. So by next Wednesday, April 30th. And our next Teach Educational rounds will be on cultivating self-compassion in clients after relapse on May 14th, and registration will open for that soon. We'll have it open tomorrow. And similar to this webinar, we'll leave some space for people to submit any questions ahead of time that they have on this topic. And if you missed a portion of today's webinar or want to view it again or any other Teach Educational rounds, we do have an archive list on our website that anyone can access. And that's it for today. Thank you both Lauren and Laurie for presenting, and thank you everyone for attending, and hope you enjoy the rest of your afternoon.
Thank you very much. And thanks for all your great questions.